Hi, everybody. This is Lee, and I'm talking about Medicare for All with this video. I had been talking about single payer healthcare options, but a lot of people seem unfamiliar with the term. It takes a long time to explain it, and by the time you get to the end of the explanation, the listener's like, "No, I don't like it. It's too meh. It's oppressing me and my freedom." So I'm using the term Medicare for All. Most people understand what Medicare is. It's actually a type of single payer healthcare system for those who are 65 and older. People are actually favorable to the concept of Medicare, taking care of seniors, providing them with a healthcare option that's affordable, that's universal, and that applies to people across the board, regardless of many other mitigating factors. And so, what people who are interested in universal health care, they want to expand Medicare to include everyone of every age. In fact, Medicare for All, universal health care, single payer healthcare option. And so we understand that branding is very important when it comes to healthcare policy and a lot of other policies, because the fact that people didn't realize that the Affordable Care Act, which the Republican Congress wants to repeal, is the same thing as Obamacare. And so while they wanted to repeal, were favorable to repealing Obamacare, not so much the Affordable Care Act. And so branding is important. And so rather than single payer online, the hashtag is Medicare for All. And today is the Medicare for All Day of Action. It's also the inauguration day, but there's going to be a lot of online mixing it up on social media with the hashtag Medicare for All, which is self-explanatory. Most people understand what that is. And so there's an article at Truthout that I'm going to post a link to in the description that goes through the whole concept. The broad appeal of Medicare for All, it's something that people can unite on. There's the Physicians for a National Health Plan who support this because of the rising cost of health care, and that despite progress on access through the Affordable Care Act, it's still a problem for those who do have insurance because there's still high premiums, high deductibles, and the possibility of going into massive debt, losing homes, losing credit ratings, and then also bankruptcy, potential bankruptcy from the cost of medical care. And so I'm going to make sure to post this link. And even though the idea of fighting for Medicare for All might be complex and messy, there is motivation because at one time or another, everyone is a patient. We are not Jesus Christ, perfect beings. Sometimes we get sick. Sometimes we break things. Sometimes things just don't work the way they're supposed to. Sometimes we just need general maintenance and tune-ups on our machinery to make sure everything is working the way it's supposed to. And so people just say, you know what, at one point or another, we all need it. So let's just all make sure we all have access to it and that we all are healthy. There's another article. This is the Physicians for a National Healthcare Program. They have a press release, and this is the doctors who support Medicare for All, the Physicians for a National Healthcare Program. And they are exposing Tom Price, the Health and Human Services Secretary, who is Donald Trump's pick to lead that department. And I'll let people read through that as well. But in the meantime, I'm just emphasizing that the term is Medicare for All. And you can use that hashtag when you're speaking of what people are trying to do, what they're fighting for, what they're working on. Good luck.